Major funding for KPBS Evening Edition has been made possible in part by Anderson Plumbing, Heating and Air, proud to support the mission of KPBS and privileged to serve San Diego clients. Anderson Plumbing, Heating and Air, helping homeowners maintain drain, heating, and cooling systems since 1978. And by the Conrad Prebys Foundation, Darlene Marco Shiley, and by the following. And by viewers like you. Thank you.
Good evening. It's Monday, January 10th. Thank you for joining us. I'm Maya Trabulsi. COVID and kids and new record numbers, and not just across the country. Tonight, Rady Children's Hospital tells us they're seeing a record number of children testing positive, and most don't even go to the hospital for COVID in the first place. KPBS reporter Kitty Alvarado explains.
This Omicron variant is spreading like wildfire in the community.
And the number of children testing positive for COVID is the highest it's ever been. Dr. John Bradley, the director of infectious diseases at Rady Children's Hospital, says, like the rest of the country, their hospital is seeing a surge.
Omicron compared to Delta, we are probably twice the number of hospitalizations that we had compared with last winter. But again, the kids aren't as sick. The numbers of positive tests is through the roof. That's, 5 times more positive cases are being reported now than last year.
20 children are in isolation with COVID, but the hospital says these children did not come to them for COVID at first. They came in for other reasons like cancer treatment or other illnesses. Routine tests caught the COVID infections, and the children testing positive have either mild or no symptoms. Megan Clark DiMakibo and Little Dash are visiting Rady Children's. She's the mother of 5. She and her husband are both ICU nurses in San Diego. They've seen the numbers of people hospitalized with COVID skyrocket where they work.
I am concerned.
Her children have not had COVID, but she says her 4 children are vaccinated and they're taking extra precautions with masking and avoiding crowded places.
To protect little dude here, he's here for an appointment because he's got some underlying issues and he's not old enough to be vaccinated.
Dr. Bradley says she's doing all the right things and all parents should follow suit. Take precautions and vaccinate their children against COVID, because even a mild infection can trigger a more serious illness in children.
Multisystem inflammatory syndrome of children, where after you get COVID, even mild COVID, 4 to 6 weeks later, your body has this intense autoreactive, autoimmune response to the virus.
For now, he's not as worried about Omicron as the Greek letter to come.
It would be foolish to think that we're done with Omicron, and I just pray that the next variant is not more virulent and causes more sickness and death.
Kitty Alvarado, KPBS News.
It's a good news, bad news prediction, but national health experts say the current COVID-19 surge fueled by the Omicron variant could peak later this month. And that means more sickness, but hope that the worst of this pandemic may pass. More now from reporter Chris Nguyen.
Across America, the current COVID-19 surge could peak later this month, but health experts say the next couple of weeks are crucial.
If you look what's happening across the East Coast right now, New York City, Washington, D.C., Maryland, probably Florida as well have already peaked, maybe Delaware and Rhode Island. You're going to start to see that in the statistics this week. You're going to start to see those curves, those epidemic curves bend down.
Data from Johns Hopkins University shows the decline is far from a trend, yet other regions of the country still haven't reached their peak. Hospitals in particular are struggling with the influx of Omicron cases.
Hospitals are stretched to the brink.
Nearly a quarter of U.S. hospitals are reporting a critical staffing shortage, according to data from the Health and Human Services Department. That represents the largest share of the entire pandemic.
We have more COVID patients than we've ever had before, but we also have less staff to take care of them.
Schools are also struggling to keep kids in classrooms in areas where transmission is high.
If you want to get kids and teachers back in schools, the way to do that is a multi-pronged approach, including flooding our schools with testing.
Vaccines still aren't eligible for children 5 and under, so the CDC director says the best way to keep them safe is to vaccinate all eligible family members around them.
People who are vaccinated are still protected about 70% against infection, especially if they're boosted. So the people who are ending up in the hospital, the people who are ending up very sick with Omicron are the ones who are unvaccinated.
Chris Wynn, KPBS News.
Immunocompromised Americans can get another COVID vaccine dose starting this week. 4th doses will be given to people aged 12 and older with immunocompromising diseases who received their booster 5 months ago. The CDC recommends getting another dose 5 months after the last vaccine. The agency previously recommended 6 months before another shot. The National Guard is arriving in San Diego to help with COVID testing. KPBS military reporter Steve Walsh says it's part of a request from the governor to shorten lines throughout the state.
Lines have been backing up at test sites around San Diego County.
Either they're getting their test for school, right, or getting their test for work, or just getting their test for sanity's sake. It's such a vulnerable time for us. We don't know if we got just a little cold or we're really transmitting something to our families.
Beginning late last week, Governor Gavin Newsom ordered roughly 200 California National Guard troops to 50 sites around the state. So far, 70 Guard troops have been called up in Southern California, including in San Diego. More are on the way.
We're getting more folks that are wanting to volunteer, so we have slots.
The Guard is estimating that they will be here for at least a month, maybe longer. All of the troops called up are volunteering for duty. Many have served in other missions since the pandemic began. Unlike other missions, most of the troops arriving at test sites are local, so they can at least go home at night. Steve Walsh, KPBS News.
Local medical military teams have been on the front lines at a hospital that was on the brink of collapse. Coming up on Evening Edition, members of that team share their experiences of life, loss, and faith. Demand for COVID-19 testing is skyrocketing, but across San Diego County, most testing turnaround times have been efficient. County officials say on average, labs are completing tests in just under 2 days, but not everyone is getting their results quickly. KPBS health reporter Matt Hoffman spoke with people who have recently encountered issues at transit testing sites.
My wife, my mom, and myself, and we're all three waiting. None of us have heard anything.
Bay Ho resident Adam Epstein is one of hundreds who turned to transit station COVID-19 testing sites over the holidays. But now, more than 10 days later, he and his family still have not gotten any of their results.
And we were just driving down the street here and saw it and flipped a quick U-turn and came in and we're done.
We were very excited, and we actually spoke with you that day. We were excited that we were able to make it work. And it ends up, we almost wish we just wouldn't have seen that, because then we would have gone somewhere else and probably would have had our results by now.
The Epsteins are not the only ones who are waiting more than 10 days for results. The Metropolitan Transit System has been getting complaints about their testing partner TestSD.io, which is operated by Broadwell Health.
It's been a very terrible and frustrating experience.
Mission Hills resident Veronica Platt Longstreth and her husband were tested twice at transit COVID sites. They got the results for one, but still haven't heard anything for tests taken on December 30th.
It's a public health hazard because people don't know whether they're positive or negative.
Veronica was excited to find free testing sites that did not have long lines and were promising results in just 1 or 2 days. So she went on social media and let her neighbors know all about it, something that she now regrets.
We feel bad. We've sent all these people to the testing site and no one's gotten their test results.
And I am on day 13 today.
Mission Hills resident Becky Webster was one of the neighbors that saw the social media posts. She says she was tested at the Old Town Transit Center on December 28th, but still doesn't have any results.
Not a thing. Not, hey, we're running late or nothing. Of course, my results are useless at this point. But my feeling now is I just want to save other people through going through this misery.
Broadwell Health, which oversees the transit testing operations, issued a statement saying due to a sudden increase for demand in testing over the holidays, they failed to meet their anticipated 1 to 3 day turnaround time. The company is apologizing, saying they are now increasing staffing capacity and adding more labs to increase speed. The Metropolitan Transit System has been allowing the testing to be done at about half a dozen of its transit sites over the last few months. They said in a statement that Broadwell Health has been responsive to MTS by developing a plan to reduce the wait times, and they say they will stay in contact with the company and follow up. Still, some are left waiting, wondering if they will ever get back their results.
With the guidelines from the CDC, at this point, it doesn't even make sense for us to, the results won't mean anything at this point.
Matt Hoffman, KPBS News.
San Diego police are investigating a fatal shooting this morning by 3 officers in the Stockton area. Police say the officers were checking into a report of a robbery at a liquor store near 32nd and Imperial when the suspect pulled a gun on them in an alley. The officers opened fire, killing the suspect. Hours later, Jesus Pisa was talking with friends close by the liquor store. He used to live in the neighborhood and said he'd like more police patrolling the area due to minimal lighting at night and what he says is frequent crime.
It all depends on who you ask. Some people do welcome the police because they know they can be protected by them. Some people don't like them because of the bad rep they've been having for years.
The suspect, whose name was not immediately available, died at the scene. An employee at the liquor store who did not want to be interviewed also said that the store was robbed last night. 4 weeks of Republic Services labor strike in Chula Vista and Mira Mesa has caused a lot of trash to pile up across neighborhoods. KPBS reporter Alexandra Rangel shows us what's being done about it.
With all the extra trash people have around the holidays, it's just gotten out of control. The smell, the rats, it's just bad.
Rodents, bad odors, and dumpsters filled to the brim can be seen across neighborhoods in Chula Vista as Republic Services labor strike continues. Chula Vista Mayor Mary Casillas Salas says she wants this public health and safety threat to be resolved. She says the labor strike will be discussed at Tuesday's City Council meeting and all options will be considered. That includes taking over trash collection with cavity crews or finding another company to do the job. Republic Services promises all trash, recycling, and green waste will be picked up starting Monday. Donnie Castillo, a driver with Republic Services, says they're hoping the mayor's pressure will result in a contract they think is fair.
We saw it as a hopeful sign, as a sign that we are being backed by the city, and we hope that stands.
As contract negotiations are at a standstill, Castillo says drivers want to see results.
Trying to, have our word heard a little bit stronger.
Strikers moved their picket line location from the Republic Services offices to the front of the landfill, hoping to add pressure and make their voices heard even louder.
We do apologize for all the inconvenience that this is causing, but it's definitely something that needs to be done, and we can't go back to work unless we have a fair and just contract.
Residents could be seen driving up the landfill to dump their own garbage. Alexandra Rangel, KPBS News.
Governor Gavin Newsom unveiled his $286 billion state budget proposal today. It includes $2.7 billion to fight the pandemic and adds another $2 billion toward ending homelessness. The plan would also make California the first state to cover everyone under its Medicaid plan, regardless of their immigration status. Education reporter MG Perez highlights what the budget proposal means for our local schools.
Another 205,000 COVID-19 self-test kits arrived at this San Diego warehouse Sunday morning, and today were on their way home with students across the county. The California Department of Public Health has not kept up with the demand for parents wanting to make sure their children aren't spreading coronavirus. Teachers are concerned, too.
Oftentimes, we cannot count on the state or the county to do what is right. By us and our students.
It's called dealing with reality.
Governor Gavin Newsom did not mince words in a 3.5-hour press conference live streamed on the web and social media. It is his first time presenting his plans for the 2022-23 state budget. He calls it a blueprint, and it includes $2.7 billion to increase COVID vaccinations, more statewide testing for the public and school staff and students.
So many things I promoted and promised when I put myself in front of the voters 3 years ago have been reflected in these budgets. And so it's a point of pride, but also a point of passion. It's the why.
When it comes to education, the governor starts with the ride to school. The budget has $1.5 billion to electrify the state's entire school bus fleet, including charging stations. In the classroom, the budget offers $2.9 billion to help the teacher shortage, increasing the number of teacher preparation programs, more career counseling to encourage teacher recruitment, and waiving all exam and credential fees, which could run hundreds of dollars. There's also $4.3 billion budgeted for after-school and summer enrichment programs. The California School Boards Association represents more than 1,000 governing school administrations. Troy Flint says the governor's budget could be just a quick fix.
So much of this money, the relief funds or other special programs, are one-time funds. What's going to happen when those funds go away?
That's just one of the many remaining questions people want answered. And this is just the first proposal of the governor's so-called blueprint. His final version will come in May for the legislature's consideration. MZ Perez, KPBS News.
A controversial new public safety guideline means California nurses can go back to work even if they test positive for the virus. The State Department of Public Health made the announcement over the weekend that healthcare workers can go back to work immediately without isolation or testing if they have no symptoms. The same for workers who are exposed and show no symptoms, as long as an N95 mask is used. Many healthcare workers are raising concerns over the new guidelines.
It's a major disaster waiting to happen. I think it's very callous and, it's putting our patients and ourselves in grave danger.
The new rules will stay in place until February 1st. COVID-19 cases have nearly tripled in the military since just before Christmas. The Defense Department reported just under 5,300 cases among service members on December 22nd. By January 5th, that number reached more than 13,900. In response, the military is increasing health restrictions on many bases and at the Pentagon. The military has been on the front lines of the pandemic. Military medical teams have been dispatched to hospitals overwhelmed by COVID. One of those teams is from San Diego. KPBS reporter Kitty Alvarado tells us they were sent to a hospital on the brink of collapse.
San Juan Regional Medical Center in Farmington, New Mexico, serves a vast area in the Four Corners. Dr. Brad Greenberg, Medical Director of Emergency Preparedness at the hospital, says they care for all people, no matter who they are or where they come from.
We serve a mixture of urban, rural, and frontier areas, and also are a referral center for many of the facilities that exist on the Navajo Nation.
COVID has not been kind to the region. They've had 5 COVID waves, and the last 13 weeks have been especially tough.
We were on the verge of a true clinical catastrophe. We did not have enough personnel to take care of the really incredibly high numbers of critically ill folks.
The Navy came to their rescue. 2 23-member Navy medical response teams from San Diego's Navy Medical Center. Commander Dr. Nakunj Bhatt, the senior medical officer, says they're proud to carry out this mission.
I can't imagine being anywhere else except being on the front lines of patient care.
I was really, really shocked when I heard that they had so many people that were on the ventilators.
Daniela Jenkins is an ICU nurse with a Navy team. Before the military, she worked at a civilian hospital.
I know how hard it is to be short-staffed. And it has been really amazing to hear these nurses say, hasn't been like this in like a month.
Dr. Greenberg says the Navy's arrival did wonders for the hospital and morale.
Boy, what finally a little bit of a tailwind, some inspiration, and feeling like we're all in this together.
He says they saved the hospital from collapse and many lives in the process.
Any patient that makes it, it almost like heals our soul. And those are the wind that they keep me going.
Not every story ends this way, but Lieutenant Commander Charles Volk, a pulmonary critical care doctor, says losing a patient doesn't mean failure.
And part of our job is, to be there. If we can't cure someone or we can't heal them, is to care for them, at the end of their life and make sure that the end of their life is as good as possible.
Jenkins says success is also measured by those they treat with compassion, even when patients can't feel it.
That time is so special because that is time the patient's not going to remember, but the family does.
These heroes are human, and these experiences leave their mark.
There are times where it's hard. It really is hard, and you just have to step away from it. We're all human. There's times where I've cried.
No, absolutely.
Nurse Jenkins says seeing death is hard, and experiencing loss during the holidays somehow feels different.
It's tough. I mean, walking into a room and seeing a lifeless soul there, it's hard. It's not easy, especially on Christmas Day. That was tough.
But those experiences have changed them for the better, too, and they will carry the stories of this community with them forever. Dr. Bott says they learned from those they cared for.
We're very close to Navajo Nation, and hearing some of their stories and their practices and all those things have been very touching for us, and it's been a profound kind of experience.
Dr. Greenberg says they too will live on in the hearts of the staff and community because they answered the call when they needed them the most.
It's our sincerest appreciation for your sacrifices and for your willingness to come out here and help make a difference.
And news of their good work traveled to Mayor Todd Gloria in San Diego.
And from the bottom of my heart, I thank them. They represent the best of this country, the best of our city.
This means a lot to those who served on this mission for over a month through the holidays and New Year.
Honestly, that's all that matters is thank you. It matters a lot. Those two words mean a lot to us.
But as they were leaving, another COVID wave is hitting the rest of the country. That's not lost on Dr. Greenberg.
Well, we're sitting right at the edge of our seats waiting for the Omicron to really make itself known within the state of New Mexico and the region.
As this virus continues to mutate, there are many unknowns. But having heroes like these on the front lines, 1,000 of them who will soon be deployed, brings hope to those communities that are facing or are about to face the worst. Kitty Alvarado, KPBS News.
Extreme weather is expensive. Weather disasters have cost the United States $750 billion in the last 5 years. The National Oceanic and Atmospheric Administration reports that 20 weather and climate disasters just last year cost the country at least $1 billion during each event. And that includes the deep freeze experienced in Texas, as well as a hurricane that devastated the region from the Gulf Coast to the Northeast. The total economic toll for 2021 was $145 billion.
We've had high pressure and control over the Great Basin, and that's brought another Santa Ana wind event, and that'll continue likely through Tuesday, but by Wednesday we'll start to see that onshore gradient making a return. Temperatures that are well above what is average for this time of year as a result of that Santa Ana wind event, but they will relax a little bit later in the week with a cooling trend for most on the way. And we're looking to stay generally dry. No real rain chances or significant rain chances here in the forecast over the next 5 days. We do have wind advisories in effect here in the mountains and further inland, and that remains in effect until Tuesday evening. As we head into tonight in the metro, temperatures falling back into the upper 40s for you under mostly cloudy skies. Elsewhere tonight, we're getting down to 43 for you in Oceanside, 51 in Ramona, 43 in Borrego Springs, 43 for you out towards Mount Laguna. Tuesday is another quiet day here, high pressure in control over the Great Basin, another day with Santa Ana wind event, and there's going to be more dry air that continues here across much of the southwest. But things should change a little bit as we head into the later part of the work week. I think Wednesday's still a warm day for many. By Thursday and Friday, we'll start to cool things off. For your Tuesday, temperatures for you in Chula Vista getting up to 74, 75 out towards San Diego, El Cajon closer to 80 degrees, 73 in Borrego Springs, and 52 out in Mount Laguna. Near the coast, temperatures will go from the low to mid 70s Tuesday and Wednesday back into the 60s as that onshore gradient does make a return for you Thursday, Friday into Saturday. Further inland, temps similar trend, upper 70s Tuesday, Wednesday, back into the 60s Thursday, Friday, and moving into Saturday. A little little bit of an increased cloud cover there Thursday and Friday. In the mountains, temperatures low to mid 50s Tuesday, Wednesday, Thursday, and then a drop off into the upper 40s Friday and Saturday. A possible shower there later in the day on Friday in the mountains. And in the deserts, temperatures really don't look to change a whole lot, generally staying in the low to mid 70s. For KPBS News, I'm meteorologist Jessica Pash.
The entertainment world is mourning the sudden passing of actor and comedian Bob Saget. He was known to millions as America's dad on the hit show Full House. He also hosted America's Funniest Videos. The 65-year-old was found dead by deputies following a 911 call to his hotel room in Orlando, Florida last night. Saget had performed his stand-up act the night before. Deputies say there was no sign of foul play or drug use, but an autopsy will be performed.
I'm Judy Woodruff. Tonight on the NewsHour, as COVID surges, we examine whether the CDC's latest guidance is effective or creating unnecessary confusion. That's coming up at 7 after Evening Edition on KPBS.
And here's another look at today's top stories. The number of patients with COVID at Rady Children's Hospital is twice as high as the peak last year. The director of infectious diseases says these children went to the hospital for other reasons and routine tests caught the COVID infections. He urges parents to vaccinate their children because even mild infections can trigger more serious illness. And the National Guard is arriving in San Diego to help with COVID testing. The Guard is estimating they will be there at least a month, maybe longer. Governor Newsom ordered roughly 200 California National Guard troops to 50 sites around the state. So far, 70 Guard troops have been called up in Southern California, including San Diego. You can find tonight's stories on our website, kpbs.org. Thanks for joining us tonight. I'm Maya Trabulsi. Have a good evening.
Major funding for KPBS Evening Edition has been made possible in part by Anderson Plumbing, Heating and Air, proud to support the mission of KPBS and privileged to serve San Diego clients. Anderson Plumbing, Heating and Air, helping homeowners maintain drain, heating, and cooling systems since 1978. And by the Conrad Prebys Foundation, Darlene Marco Shiley, and by the following. By viewers like you. Thank you.